Jai Jagannath. Welcome to our channel Lifebliss Health Connect section. Today I will be discussing dietary requirements in pregnancy. Now, pregnancy is a very specialized part of life of a woman where a lot of changes occur and there are a lot of nutritional demands. This is a challenging condition for most women because they go through a couple of phases which is very unusual. But before taking up a pregnancy, we would like to counsel a woman who and when, what, where she can now conceive. Now, looking at her body types, previously we had studied some of the body types in our previous, if you refer to the previous videos, you will understand that we had discussed about being underweight or being optimal weight or being overweight. Now, a woman can be categorized in any of these things. If she is highly obese, and which is a common phenomenon because of the sedentary lifestyle, work from home, or even people working in extended period of hours in the office, they don't find time to exercise, and these are the target people who definitely suffer from some sort of a metabolic condition, and then we have to tailor make their diets for them. Now, first I'll begin with a normal woman where she has no problem, she's neither underweight, she's perfect, and now how do we plan the pregnancy? After doing a couple of tests where we ruled out she's not a potential diabetic, she doesn't have any thyroid disorders, her hemoglobin is okay, she's also perfectly in mental state to take up a pregnancy, then we ask them to attempt pregnancy. In this intermediate period, we give them a short course of folic acid, or it's also known as folate in the diet. Now, folic acid is a very important component to prevent any type of birth defects in the baby. So, priming the girl who's opting for a pregnancy always helps. In many countries, folate is added to the wheat or even any of the flours that people use over here. So far in India, we have not done this. How much is the folate requirement? The folate requirement is usually 500 micrograms, but the tablets that come is almost 10 times, that is 5 milligrams, but we start that on a regular basis. After she's been put on folic acid and she has a conception, the conception will start with a period where there is likely to be a disturbed appetite, where the appetite usually is very poor. Patient might just feel a sense of nausea, very often accompanied with vomiting, and quite often that they have vomiting which is uncontrolled. Now, if it's just plain nausea, we can give her some Stemetil tablets. Or if it is very bad nausea, we add some lifestyle changes, like we ask them to get up very slowly, begin the day with some biscuits, and then go up for brushing, and then they can start the tea, whatever they want to have, which you usually have in the morning. Dietary recommendation for this condition, we ask them to avoid coffee. If necessary, avoid the tea also, and can be coupled with milk. Now, after brushing, she can take a light breakfast. The light breakfast usually would be protein rich. That is what we recommend. But she can have, for an Indian setup, she can have usual poha, she can have upma, she can have idli, she can have bread. She should avoid almost all sorts of things that come out from the bakery. If that is largely possible, then whatever is made at home, the carbohydrates should be those of hardy millet, which could be in the form of dalia, it could be in the form of rajgira, or any of the similar things that you have. Now, in the middle of the period, the lunch period that she's going to have, the lunch should be fairly whatever she can now consume or she prefers to have, because the appetite is already, she's under nausea and the vomiting can sometimes become quite bad. So whatever she's desirous to eat, she can eat. Same thing she can repeat at dinner time. Only thing that she has to see that there is adequate water intake so that there is no water loss, because water loss can add to an excessive vomiting. So vomiting, if it occurs very periodically and very nagging, then the patient might have to be taken to the hospital and given saline. When the saline is given, please understand it is nothing but water and salt, electrolytes and sugar. So this is the only thing that requires correction. Now, once she enters the second, third month, that is called the second trimester, that's usually a period of eating. The patient wants to eat, she's come back to her normal appetite, and then what does she add to this? So far in the first 3 months, we tell the patient, eat whatever you can, because your body weight should not drop dramatically. If there's an excessive body weight drop by more than 5 to 7%, we consider it abnormal and we have to give her salines and then take her to give her medication, give her injection. But if she has been going within the normal limit of her weight, then comes the time when she can be allowed to eat. Now, most important thing is that we divide what is a normal caloric requirement of a woman. For a woman who is sedentary or she's doing office work with minimal exercise, the caloric fuel requirement is about 1500 calories to about 1800 calories. For pregnancy, we add another 300 calories. Now, in the first 3 months, it is only 70. In the second 3 months, it is 250 to 300 calories. And in the last 3 months, it is from 450 to 500 calories can be added. Now, how do we add this? So, whatever she's eating, we tell them to have essentially 3 meals, which is broken up into breakfast, lunch, dinner, and 2 snacks in between. And at bedtime, if she feels that there's a lot of acidity, she may be given some lukewarm milk. So this forms the thing. So how do we fill this gap? So her diet requirements, if we have to divide this 1800 calories, we ask them to take around a third for lunch and a third for dinner. So that means around 60% is taken over there, and the rest 20% is for breakfast, 10% for 2 snacks in between. So that compromises a full 100%. Similarly, in the last 3 months, we will be giving the same breakup, but the caloric fuel requirement will increase. So how do we do this addition? So in addition to whatever she has been consuming so far, she will require to increase her protein intake. Now, very important that there is a drop in the hemoglobin, because nature is preparing the girl for delivery. In delivery, the girl is likely to lose about half to almost 3/4 of a liter of blood. So much of blood that is going to be lost has got to be made up in this couple of months. So supplementary iron is given. Now, iron-rich foods can be taken, which are usually green leafy vegetables. There are also liver. Those people who opt for non-vegetarian food then can be in fish, liver, and eggs, but essentially also in nuts. Now, they have to increase the carbohydrates. Now, carbohydrates that's the energy-giving thing. So you see that your carbohydrates are usually complex carbohydrates, which means you don't take simple sugars, avoid sugary fluids, because we are seeing an increasing number of diabetics in our country. So avoid sugary drinks, but have the calories in form of hearty carbohydrates. Avoid maida, avoid bakery, usually have brown rice, or take up bajra, bhakri, millets. All these things can be done. Wheat, in those people who are not potentially diabetic, wheat can be consumed safely. Now, what are the fruits that can be added? Good fruits in the pregnancy are those which are colored fruits. Now, colored fruits are very easy to get. You can get them from strawberries in the season, or you can take melons, you can take many other fruits. Banana is a staple thing. Nature has made banana in plenty. It is cheap and can be had easily. But those people who are overweight or having diabetic tendency, they should avoid bananas. Other fruits that can be used very easily are Indian, which I would suggest to you, is what are grown, homegrown, and not which are orchard grown. So those things coming from abroad are highly sweetened. They look very nice, but they attract a lot of calories. In these things, you should choose to have apples, you can have guavas, you can have pears, you can have winter melon. You can also choose to have strawberries. You can have other nuts along with it that come. So what are the nuts that we choose to eat? Now, the nuts should be essentially tree nuts. So tree nuts means we are now dealing with almonds, we are dealing with walnut, pista, we are dealing with hazelnut. These are very good sources of DHA. This DHA is an oil that is required for very much for the growth of the baby's eyes and brain. So one snack, which is either at 11 o'clock or 4 o'clock, should be a handful of nuts. Other nut which is on the ground, that's called groundnut, has a high quantity of proteins. So those people who cannot consume eggs or are allergic to eggs or for religious purposes don't want to eat eggs should be given a substitute of peanuts. And what are the other proteins that we could add? We could add soya in them. We could also add beans, legumes. These are usually rich in protein. The other good protein that is available is dairy. So now in dairy you can have processed cheese also, you can have cottage cheese. They are good source of proteins for the woman who does not opt for animal protein. Now how much protein should be required? Usually about 70 to 100 grams of protein is required for the baby building towards the second half of pregnancy. Now, if a woman whose average weight is around 60, you just take it 1.5 times for the pregnancy, because the growth of the baby requires a lot of proteins. Along with that, iron is required. A good source of iron is green leafy vegetables. Again, you have liver, you will have nuts. So now these are usually expensive. So the doctor will always add a supplement in the form of iron. Now, calcium is a very important component both from the growth of the baby's bones. Now, baby is essentially a parasite in the mother. So, if the mother does not consume enough calcium, the baby is going to pull all the calcium from the mother's bones, making the mother always having pain in her bones, which is usually the back, the ribs, and the spine. So, to counter that, how much of calcium do we require? We require around 1.2 to 1.5 grams of calcium a day, which means 1200 to 1500 milligrams. Now, how can you get a dietary calcium? Now, dietary calcium, milk is a good source of calcium. Fish is a good source of calcium. Now, you have nuts also, which are good source of calcium, but milk will give you 1 ml milk will give you 1 milligram. So, to get the entire thing, you will have to drink about 1.5 liters, which is either not very comfortable for a woman, it's also not affordable. So we add calcium tablets, which is in the form of 500 or 1000, depending what the doctor writes for you, and you take these calcium supplements. Folic acid is another thing. Those people who have got anemia, they will have to continue with taking folic acid. So now we are coming to the final this thing. Now the woman in the last 3 months begins to have a lot of heartburn, which is called a reflux acidity. Now in this, she'll have to take smaller quantities of meal. The same calories have to be spread out a little more, but can be spread out into smaller meals every 2 to 3 hours. If she can consume the full meal, that's well and good. If she can't, she has to rest. Resting may not be immediately following a meal and may require around 45 minutes to 1 hour. After that, she can lie down on one side so that the digestion is easy for her. So after consuming all this, now she is ready for a delivery. Now during delivery, of course, there's a different dynamics itself. Once the baby comes, the nutritional demand changes a little bit. The calcium content has to be increased, the caloric content has to be increased, and the woman is doing no activity. All this while in pregnancy, she was moving around, but in post-delivery, she's usually attending to the baby and it's requiring nutritional requirements. So for this, she will have to have increase again the caloric value of all the food. Now we'll see special requirements. Those people who are very thin, they will have to increase their caloric fuel requirements, which can be having a lot of oily food that can be had. The oil preferred is to be clarified butter, which is ghee, or it can be plain butter, or it can be any of the oils like mustard, coconut, they are in order of that, sunflower, and last of all, groundnut oil. Choose the oil that you want. You can take in a little more extra tucking in of food. Try to avoid outside food. Clean water is a very important thing. Avoid sweets for sure. Instead of taking sweets, you can make smaller things at home and have to get over the sweet craving. But avoid sweet because diabetes is a huge problem in our community, and we are seeing every fourth patient coming in as a potential diabetic, and this high sugar in the mother has got absolutely damaging effect to the baby. Those people who are highly obese, can they lose weight during pregnancy? If properly given a diet which is rich in proteins, low in carbohydrates, maybe a little high in fats, the woman is going to lose weight without compromising the weight of the baby. Special diet may be tailor-made for those people who have hypertension, where salt content is reduced. Now you need not reduce the salt in your food, but you definitely take the add-on salts like pickle, papads, chutney, all these things, and preserved foods a big no-no. Try and also not consume any of the sweetened foods or fortified foods which come out from outside. Fortified foods are made simply to improve the taste. Really, they don't have much nutritional overages. Now, the other thing that required is some women now we are seeing are undergoing bariatric surgery and then taking up a pregnancy. That means they have either they have to lose weight 20-30 kilos before they take up the pregnancy, a special diet can be made for them also. So whether we add that thing, we'll ensure that the protein block for the baby's growth is not affected, the carbohydrate does not change the mother's weight so much, and the fat content which is required will be added according to the fuel requirement for the mother. Now, usually frequently asked questions. Now, some of the mothers, grandmothers accompany the woman and they ask, can we give this? And they force feed a lot of things. Note that during their time, they will tell you, we used to eat this, we used to eat that. Nutritional requirement has been the same, has not changed. But the availability of food at the time of our parents were much less. So women, you were last. They used to be fed last. At that time, the requirement was that whatever had to be given to a woman in pregnancy had to be given at that time. So grandmothers, mothers, aunties used to get food which was rich in carbohydrates, rich in sweet and rich in butter, oil, ghee, all these things. Now we don't need to see this because hardly will see a woman who is nutritionally challenged. They are only from the very, very low socioeconomic group, and as a result, they should be given this extra bit of diet which is required. Now, many people ask, what are the fruits that we should avoid? If you have a diabetic potential, then you should avoid bananas, chikkus, custard apple, mangoes, and grapes. These are 5 fruits I would tell you to keep away. Now, should you avoid any of these sugar drinks? Yes, it is a big no. No sugar drinks should be available except a woman who's on a diabetic and she feels giddy. She may be given a small sip or two for that to recover her sugar. Then how much food, how much she should eat? Should she have a late night meal? Should she go out and eat? Now, eating out can cause a lot of acidity, can cause even a stomach infection. So you have to be very, very careful about that. Now, how much fluid people ask to drink? Normal in pregnancy, try to drink your fluid during the day and not at night because it can be very discomforting to get up and pass urine most of the times at night. So the amount required is usually around 2 to 3 liters of fluid that is required. If that is more than sufficient. In summer, you might add another half liter. Can we go out and spend some time? Take a short vacation. Now you have a lot of vacationing sites that people want to do because they may not be able to go out for the next 2 or 3 months. So in that case, yes, try to carry as much food from home as possible, or wherever you're eating, it has to be a very clean and hygienic place. Avoid street food. That's very important message I want to give you. You should avoid street food. Now, what is good for the baby? Usually the mother asks, what is good for my baby? Whatever diet that you had been consuming is good for your baby. You only need to add the extra nutritional requirement. They'll ask you whether you require expensive multivitamins. They require nothing else is required. A good diet, a balanced diet is more than sufficient. Nuts are very good. So one snack can be of nuts and one snack can be of a fruit of your choice. Is there any other problem that we can have having this? Now, one of the commonest thing that we see in our women is anemia. And the commonest cause of anemia is either nutritional or it has got worms or infestations. So for any woman who is having chronic anemia must also rule out a thalassemia trait. So all these investigations, your doctor will advise and treat you accordingly. Now, with all these commonly asked questions, I think I'm going to now conclude. And if you have any questions to be asked, do send us a feedback. We'll be glad to answer. Also, please note that you please subscribe to our channel, make it viral, spread it among your friends, and this will help us to serve you better. Thank you.